see this laptop that's just come onto the podium here. I'm going to stick this USB stick into this laptop if I can. Yeah, there it goes. Now, in that USB stick, there's something wet from two worthy gentlemen, okay? I won't tell you who they are, but what we're going to demonstrate throughout my 10, 15 minutes, something's going to be happening in the background. I'm going to leave you all in suspense, but this will be the world's first in a public audience, a real new medical innovation. So let me begin my presentation by really saying to you all that I'm a bit of an imposter, basically. I'm sort of what we call an electrical engineer. I spent most of my career developing really low-power microchips for technology like this, for mobile phone technology. But about 10 years ago, a cochlear implant company approached me. And this cochlear implant company asked me if I could replace a whacking great digital processing chip that was being used for a born deaf child and replace it with a small low-power microchip that could be fully implanted in that child's head, basically. So we produced one of the world's first totally implantable cochlear prosthetics. And it just demonstrated to me that if we apply a fraction of this technology to healthcare, you can make major, major innovation. But we're doing it all wrong. Because basically, the digital world gives us ones and zeros and bits and bytes and terabytes, the internet, the web, and IP addresses that connect all these terminals together. Fantastic. But biology doesn't think with 20 bits. We don't see with 20 bits. We don't hear with 20 bits. Yet we're trying to force these two different worlds together. We're doing it all wrong. I want to present to you in the next 10 minutes or so that actually biology deserves its own IP address. And I'm going to show you now what I mean by the biological IP address. So we've seen over the years demographics. There are more people living over 65 than under 16. I had to adjust those numbers, by the way, to suit my age. So the WHO, sorry about that. I mean, we got the wrong numbers there. But basically, the fact is that we all see that people are living longer. The medical device industry has been invigorated by new technologies. But we've still got challenges. In the UK alone, there are more than 20 million people suffering from chronic disease. So it's not just a US problem. It's a UK problem as well. So we need remedies. And we're getting remedies. We're seeing these new technologies. We've seen some here at TED today, these fantastic sensors, brilliant sensing technologies. And we've got wireless digital technology, such as mobile phones, that can do the wireless monitoring. But as I mentioned at the start, we're doing it all wrong. Biology is analog. My contention is that our whole system, our brains, the way we think, are analog. If speech were digital, I'd be shouting or not shouting. So we're basically interfacing to the wrong world. So what I want to get across to you now is how can we create real biological paradigms and not paradigms just from the digital world. So what is happening with all this sensor technology? You know, we're being bombarded with unintelligent sensors that go to the body, they measure all these vital signs, all these parameters, they go off to some database in the hospital, and we've seen it throughout the whole of TED, we've got a data overload. And just for one chronic disease population, we could end up using hundreds of petabytes, that's 1 million terabytes of data per day, just to service that sort of community. So when we go and look at why the digital revolution, we started off with the mainframe and the dumb terminal. The mainframe then went into that dumb terminal, and we called it the PC, and we had the PC in the 50s and 60s and 70s, and then we've got the internet. The internet came along with the web, and then what we start doing is chucking out the guts of these PCs, throwing them to these things called the cloud, and then our dumb terminal becomes a browser. So same concepts, just new technology. But in biology, we effectively haven't moved. We are still at the mainframe stage. We're just chucking unintelligent data to terminals. We're doing it wrong. We need to create this biological IP address. But what I want to show you on the next slide is one of my heroes, this chap called Boltzmann. Now, Boltzmann came up with this theory that molecules move in matter following this beautiful exponential distribution of energy. And that's exactly the same way that semiconductors work in transistors. So if you take a semiconductor chip and you apply a signal, the electrical current in that semiconductor follows that wonderful exponential. And we all know what exponentials are. We teach our kids homework, and we use exponential and logarithms and all this mathematics. But what's fascinating, actually, is in biosystems, in nervous tissue, ionic current also flows following those exponential distributions. And this is phenomenal because, in fact, there was a Nobel Prize won several years ago by Hodgkin and Huxley, and they showed that all the nonlinear conductances in nerve axons follow these mathematical computational elements called exponentials. We've got that physics in the semiconductor, but what do we do with it? We crush that beautiful physics into a 1 and 0 and make lots of logic gates and try and interface it to the biology. Crazy. Biology doesn't understand that. So what I want to be able to create a new biosystem, spot the monkey. Now, you spotted it instantaneously, I hope, okay? I hope. But the best digital computer on this planet could not have spotted that monkey instantaneously. The retina's ability to access, process, store, and ship out large amounts of information instantly differentiates us from any digital machine. Yet the brain of a common housefly, smaller than a grain of rice, could have also done that instantaneously. The retina's fascinating. It takes all this high bandwidth information, it compresses it onto 100 million photoreceptors, and then it ships low bandwidth information to the brain. So every single pixel in the retina has local intelligence. Everything's done locally. All the processing is done locally. Why don't we use that paradigm of intelligence for our sensors? So these are my attributes. These are the sort of ingredients, if you like, of what I'm calling my biological protocol. It has to be continuous, distributed, real-time, efficient, low power, local intelligence. None of that is satisfied by the digital world. And these chips need to operate in a region that we've ignored. The digital revolution has eclipsed analog. And we've got to bring it back for biology big time. And I'll show you examples now how it's actually worked in practice. So let's look at the first example, which is the neural IP. This is a chip that's now being used in several hundred born deaf children. And what the chip does, it models the basilar behavior, the basilar membrane behavior of the cochlea. The cochlea is the heart of the ear, which when defective results in stone deafness. Its function is to take a time-varying pressure wave and convert it into signals, 20,000 hair cells that connect to the eighth nerve in the brain. We've replaced that whole biological behavior with a microchip using that physics of the semiconductor. And the microchip is implanted on 16 electrodes connected to the eighth nerve. And it's powered up with an inductive loop because it's so low power. So you don't need that horrible digital processor anymore. But what's really fascinating is that the brain, the cochlea, has 20,000 hair cells. We've replaced 20,000 hair cells with 16 electrodes. And the brain has all the plasticity and regeneration properties to give a born deaf child legible hearing with a technology or a language that biology really understands. Let's move on to another piece of IP. This IP is called the sensium. Now, the sensium is not a Pentium because it's not for the digital world. It's for the biological world. It's a small semiconductor chip we created a few years ago that actually mimics the biological behavior of the heart. It looks at measuring ECG, it can work out arrhythmias, heart rate variability, etc., etc. It's a truly intelligent device. And it's packaged in this thing called a Band-Aid, so we're hiding the fact that there's all this sophisticated electronics behind this, and it continuously measures all those vital sign parameters and sends them off to a PDA or to a hospital database. The device was FDA approved in July and now is being deployed in several major hospitals here in the US. The concept being that the device then can sit on the chest and it can wirelessly measure your parameters. But the big deal here is that patient now can go home with this device. So now you're taking the hospital home with you. Then you've got now 24/7 monitoring post-discharge in the home environment. That's the sort of sophistication, and it's like this, and it's disposable because we're not using digital processing, we're using analog processing. Another piece of biological IP is the metabolic IP. And whenever we think of the metabolism, we start thinking of diabetes. This poor child on the left was one of the first children 100 years ago to be given insulin for type 1 diabetes. And look at the same child on the right. First demonstration of insulin. What you don't see, however, is that child's got no legs. And the reason that child's got no legs is because insulin was only given once or twice a day. The child was not given the 24/7 secretion of insulin that the pancreas or the beta cells give you in your true biology. So I set on a mission. I said, look, let's forget all this dumb technology that hasn't changed over 70 or 80 years. Let's go back to the pancreas, right? And let's understand how the pancreas works. Now, the pancreas is made up of islets, and these islets are made up of beta cells. Now, these beta cells are intelligent neurons. And they've got action potentials. They work exactly like the neurons in the retina, in the cochlea, and now in the pancreas. And I wanted to take the cell behavior of those neurons or of those beta cells, and the beta cells are intelligent because what they do is from the glucose levels, they work out how much insulin you need. And they generate that insulin and give it to your body. So it's those devices which are the gems. Those are the devices we need to create. And we did that. We took all that mathematics of the biology and we created one of the world's first silicon beta cells. A cell that truly mimics the way the pancreas works. We took that chip, we applied it to an off-the-shelf pump, which is a normal insulin pump, but that pump now is intelligent because that pump is secreting insulin continuously on a 24/7 basis in the way the pancreas does it. It's basically bio-inspired. There's no digital, it's analog. We then took a glucose sensor, we put it onto the abdomen, we take the pump, we put it onto the abdomen, and then we can use, if you like, a dumb radio in the background. The radio now is dumb. The radio's got no intelligence, just sends the results of the data. It doesn't need to send the data. The results are all done locally. And in this technology, you've got both a diagnostic and a therapy at the same point. So it's true personalized medicine based upon the physiology of the pancreas. And then we modeled that, and you can see it sort of behaving as the pancreas should behave. And I'm pleased to say we've passed all animal trials, and this is going into humans in November, mid-November this year at St. Mary's Hospital in London. Thank you. So last but not least, I've shown you, therapy, I've shown you diagnostics. Well, what about early detection? And what about the whole genome world? We all know that there are 3 billion bases in the genome, but what I want to focus on is not these 3 billion dumb bases. I want to focus on the 0.1% that we differ by. Our mutations, the things that tell us our predispositions to different genetic diseases, the things that tell us if we can metabolize drugs or not. Those are the things. I want to make a chip for every single mutation so that you can check a particular mutation. Instead of having your whole genome sequenced, who wants all that information? You just need to look for what you want. And we've been able to do that. And we've been able to do that because several years we invented a way of turning on and off semiconductor chips with DNA. We invented this idea about 10 years ago, and it's now matured. And it's a fantastic idea because what it means is that you can use now standard microchip technology off the shelf, and you can take things now like a normal sort of silicon wafer, and on that wafer, you can create something that looks like a handheld device with a small chip, and on this small chip, you take your saliva, you take a saliva sample, and with that saliva sample, you can then measure whether or not you've got the mutation, because on this chip, you've got the reagent for the particular DNA that you're looking for. So this could be the chip for type 1 diabetes. It could be the chip for warfarin. Now, what I've done today is I've actually, for the first time, we're doing a live experiment. I've taken saliva of 2, I think, healthy individuals. This one says M, and this one says J. Now, because I'm not allowed ethically to do a true diagnostic, what I've decided to do is look at a mutation which we all should have, which is the metabolism mutation, the human metabolism mutation, which determines whether these individuals are human or not. Okay? And so what we've done now, the big deal is, if you look at what's happening, is on the tops, you see the standard way of doing things like 23andMe. They'll take your saliva, they'll send it off to a central lab, they'll pipette, they've got the white coats, they've got PCR, they've got detection. It takes about 2 weeks, and you end up with a result being sent back. I can do it in 15 minutes on my microchip. And the whole point is, and I'm not just doing it in a handheld device that looks like this that I showed you earlier on, we've actually progressed quite a lot. We can do it in a USB stick. The chip, once you've got the saliva goes into a small little device like this. You turn the lid, out of that will come the DNA, the pure DNA, and this is all done in seconds. The DNA goes onto the chip. The chip then goes into the USB stick, and all the analysis is taking place on this USB stick, which you then put into the computer. So what we've got now are the results, and I'm showing you on that chip, it's not just detection of that mutation. The chip is also amplifying the DNA. So we've got PCR and detection simultaneously happening together in real time on that result. So if we can get the cameras just to see what's happening on there, so we can check Jay's and okay, so here we go. So it's Jay's is the lower one, the purple color, and Mark's is the top one. So what's basically starting to happen there? Look at the time. It took about 15 to 20 minutes to see that reaction happening, and now they're rising. As soon as they start rising, it means that you've got that mutation. But one is rising slightly more than the other, which means that I am afraid to say, Mark, well, actually, for Jay's sake, Mark, you're more human than Jay. Okay, but Jay, don't worry too much about this, because what I've not told everybody is that the bottom trace is the DNA of a banana. Okay, and we share about 80% of our DNA with a banana. So Jay, you're not as human as this man, but you're way away from the banana. But just to finish, I mean, what's really exciting for us is that we've never done this before in public. This is using a microchip technology. Can you imagine now that for every drug, there's a chip? For every bug, there's a chip. For every mutation, there's a chip. So where's the future of this technology going? You can imagine a situation now where your biology has all this analog low-power IP address technology around it. Imagine that situation where you've got your GP now, and your GP will ping your biological IP address, he'll query your organ, and he'll debug your DNA. Thank you very much.